When you think about regenerative medicine stem cell therapy, you're looking at the speed of that recovery to shorten it down. So if it takes you sprain your ankle, you go to physical therapy, it may take 6 weeks to get you back to normal. But if you get the right signals, that right information to that damaged tissue, it generates faster. So then you heal faster and you recover faster.
Welcome to Papamutes, everybody. Today, my guest is Dr. Rhee, a sports chiropractor and pioneer in regenerative wellness, has dedicated over 5 years to the development of regen, recognizing the limitations and risks of injection-based stem cell therapies. Dr. Rhee is also the published author of The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy, in which he delves into the groundbreaking advancements in topical regenerative treatments and their transformative impact on modern medicine. Dr. Rhee has been a practicing chiropractor since 2006 and served as the official team chiropractor of the Tampa Bay Buccaneers of the National Football League from 2015 to 2018. I'm glad I got through that intro. Doctor, welcome to Papamutes.
Hey, thank you very much for this opportunity to talk to you and your listeners.
Yeah, so let's get right to it. Most people understand, therapy, occupational therapy, physical therapy, mental therapy. What exactly in layman's terms is, topical stem cell therapy?
So let's take one step backwards and understand about like injury or some type of recovery of like a exercise or an injury or some type of a setting that way. So it's all about like getting back to 100%. You have to figure out a way either through a therapy session or is it something that you can speed up? So everybody has the ability to heal. You just need that kind of like a time frame. So when you think about regenerative medicine stem cell therapy, you're looking at the speed of that recovery to shorten it down. So if it takes like you sprain your ankle, you go to physical therapy, it may take 6 weeks to get you back to normal. But if you get the right signals, that right information to that damaged tissue, it generates faster. So then you heal faster and you recover faster. So now that 6 weeks turned into 3 weeks. So when you sprain an ankle, let's say that yesterday you sprain your ankle and you get a swollen ankle, it's inflamed. So the first thing you want to do is you want to assess and see what you have. See what ligaments compromised or is it a muscle tendon? Then once you figure out the structure you're dealing with, then you want to do the first thing in reducing inflammation. So that's with the physical therapy. You'll do some compressions, some maybe some easy what they call the dynamic movements of your ankle, and then it's gonna be a little painful, but you got to get it moving. So in that process that you're going through the physical therapy in the traditional way, it's all about just getting the tissue normal as fast as possible by first decreasing inflammation, getting the tissue kind of approximate, and then getting it to heal correctly, and then loading it up and simulating exercises that do outside walking, running, whatever you want to go back into. Now, when you think about like stem cell therapy does those things quicker. For instance, like when you talk about inflammation, well, there's an information that says, all right, slow down the inflammatory process or inhibit it, and that's an interleukin 10. Once you get that in there, it slows down or stops the inflammatory, so you don't get more swelling in the area. So you want to reduce that. So now you eliminate that component of it. So then when you continue on with regenerative medicine stem cell, now you're looking at information signals that tell your existing tissue grow, heal, get better quicker. So you want that information because down distally away from our heart and our core, it's a longer travel and our vessels are, if you look at the diameter down there where your distal end of your ankle or your feet or your toes, they're very small. So then the traveling mechanism is slower because the diameter is smaller and you have to get more signal in that area. So localize, taking that topical approach, which is basically you just take this regenerative medicine regen, you apply it in the damaged area, and the saturation and the transdermal agent will pull through the skin and get to that area, localized, and it'll give those signals to do its job.
All right. Now, your book, The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy. How did that come about? I mean, the writing a book is not easy. I mean, one thing is therapy. I mean, a book I've had authors on, and it's not it sounds like, oh, cool, but not an easy task.
I'm gonna be honest with you, it was out of necessity. I mean, when you start looking at stem cell therapy, everybody has an idea. Regenerative medicine, stem cell therapy, they know it heals, it speeds it up, it does a miracle amount of things. You see all these research, but nobody really knows the mechanism behind it. there's a lot of even providers that don't know what's going on. They just know it works. They just give it to the patient, and there's going to be some possibilities of healing factor, growth. But as far as like understanding the mechanism and the principle behind it, there is that void. So I would constantly talk to people about stem cell therapy, about regen, the topical application, and these questions would be constantly over and over again. So in order for me to eliminate that type of like scenario, the Q and A's, I would say, hey, let me just write this book with the same type of questions I always hear, and I put it in the book. And then now when someone asks those questions, I read the book. Here, take a look at the book. It has everything in the layman's version and the scientific side of it. So it's out of necessity.
So, I mean, is it uh, a big book? You know, when I think of medical books, I work at a college, and some of these nursing and medical books are like ridiculous. They're like that
No,
thick.
no,
Uh,
it's real
is it an
thin.
easy read?
Yeah, it's an easy read because
Okay.
number one, it's probably like less than 150 pages.
Okay.
It's real simple. It talks about just stem cell therapy, the different kind of stem cell therapy, and then how it evolved from where it started from, and then where it's where it's at now, where it's moving to. Real simple terminology of a journey. A guy named Jeff. You can follow Jeff's journey discovering stem cell and understanding what kind of stem cells are there, what the purposes are, and then where is the future moving towards to, and that's the topical side of it. But then there's another side of it where it basically talks the scientific side of it. Looking at all the medical jargon that you'll hear about, and you kind of get lost. So you have those two versions, and it's a real simple read, and it really answers a lot of questions that you may have about stem cell.
Is this a new practice or a procedure, or is this something you knew about and just expanded on yourself?
Well, here's the thing: stem cell therapy right now and in the past was via the injections, right? A needle. That's how you deliver the actual like
Okay.
the
Not all right. So now
information.
okay. So who wants a needle? Yeah.
Yeah. So then you start thinking about, well, since I work with a lot of athletes, we always talk about I want the stem cell, but I don't want the injection because there's damage in, you're damaging the tissue because you have to, you have to deliver the actual like the bioactive biomolecules. So that you have a secondary injury site. So they wouldn't do these stem cell therapy during the season because of the downtime. You have to recover like a week or two after the injection. So nobody has that time to recover. So then you start thinking about, well, there's another way of delivering it. Then you start reading about other type of drug delivery systems, and one of them more topical applications. So once you get the actual like the agent that really does that disturbs that what they call the bilipid layer on that strand of cording, the outer layer of the skin, then you understand, okay, now I can deliver these small molecules through the skin to the deep tissue, and voila, it's the same thing as a needle.
Well, no, yeah, who wants a needle? I agree. You mentioned you're working with athletes. So let's talk about the experience with the Tampa Bay Buccaneers. For people maybe getting into chiropractic and or just in general, I'm curious myself. How did that come about?
So luckily before that, I started off my chiropractic sports chiropractic career at UCLA when I lived in Los Angeles. So when I
Okay.
graduated chiropractic school, I was lucky enough to be part of UCLA. When you're at UCLA, there's a vetting process, and once you get on the team, it's not just one team. Now you're working on like track and field, football, basketball, soccer. You're traveling around, you're seeing the other sports because they want your technique, which is what they call ART, active release technique. It's basically soft tissue manipulation. So the neat thing about that is that it gave me a twofold. It gave me credibility, but really it gave me the ability to work with these elite collegiate athletes and see if I'm good enough to get them back on the field. And then, it's a practice, so I learned my lessons through mistakes. But then once I hone my skills, my results are, of course, on the field. When I see them doing well and they're basically pain free and they're performing to their maximum level. So from there, I get to Tampa and I'm working with other athletes, WWE, the wrestling world. And then finally the Bucks called me in. They wanted someone like me as a chiropractor that really understands about little different than other chiropractors where it's not just cracking the spine or adjusting the spine. You're going into the soft tissue. So they wanted someone in that capacity, which is the ART component of it. So then I started working with them, and then it evolved into working with more complex cases of rehab or some type of issue that it may take too much time for those guys to deal with that particular athlete because there's only a certain amount of medical staff or athletic trainers working on a roster of 53 or even plus. So because of that, when you have one patient that may, or an athlete that may have a tough condition, but they need that special therapy, they would send it to me. So
Hmm.
that's how all that evolved.
Yeah, so one thing leads to another. Actually, correct me if I'm wrong, but that was during the Fitzmagic era. Ryan Fitzpatrick, the
Yeah,
quarterback.
yeah. It was an interesting time for all that. Remember?
Jameis
Okay, so
Winston.
yeah,
Yeah.
James, do you remember that time? It was maybe 2017, 18. I forgot what year it was, but we had in Tampa. We had the hurricane, so it occurred right at the end of camp, and they basically shut down that week. Everybody had to leave. I mean, it was they even had a chartered flight for some of the Buccaneers family to get in a plane and fly out of the city. Where I stood around and said, "Oh, it's no big deal. You know, it's just like another day here for me because I'm a Floridian." So that really disturbed me. In fact, that was the same season when we had the Hard Knocks. So we had the Hard Knocks, the
Wow.
Hurricane. It was a that season we should have done so well. I mean, I looked at the caliber of talent, and then everything was lining up perfectly. But that storm just threw everything out. And of course, the curse of Hard Knocks. It really sets. You can tell down the line that everybody that does Hard Knocks, which I don't know why you want to do that, but
So
it
it's
puts sets.
distracting. It
It's
seems
just
distracting. Yeah.
So
Did you make the cut? Were you on Hard Knocks?
I don't know if that. I don't really pay attention to that stuff, but I mean, you know how they go. They film like 2,000 hours, and 1 hour shows up on the
Yeah.
TV.
Oh
So
yeah, yeah, sure, absolutely. But that had to be a great experience. Now, was that a time frame you knew going in? Like, why did it end, or how did you know?
my time with the Bucks.
Yes. Was that a
Well,
contract thing, or?
no. I mean, you're contracted like every year, and you renew your contract. But I knew that my end was getting there because it was very traumatizing in the sense of working with the different levels of a professional team. You've got, of course, the front desk, you got the coach, then you got the team and the athletes, and then your job is just to take care of people. Sometimes what happens is that you have a variable that someone needs to be on the field, and your therapy needs to speed up that healing, even though their body's not agreeing with that. So you may push somebody faster on the field, or it could be discussing things that may be outside the scope of what they should know because they're seeing me outside. So it was a lot of conflict, and I didn't want that anymore. I was at the age where I don't need that kind of stress in my life. So that's how I ended that.
Yeah, all right. Well, is there a different mindset working with elite athletes? I mean, Olympians, college, compared to the average Joe. Is there a different mindset for you
Not for
when
me.
I mean, like you're talking about. I mean, the athletes are. I'm sure you've seen some amazing physical specimens as far as being in shape, and now they're hurt. Besides the ego part, is it a different approach
No, it's the
for
same.
Yeah.
Yeah, it's the same approach. It's the same approach. I do my examination. I try my best to understand the history and the mechanism, and then ultimately, do my assessment, get the anatomy correct, and all that, and pinpoint the issue and get the diagnosis, and then ask the next question: what is our goal? What is your goal? What do you want out this? Do you want to get back into that pickleball tournament? Do you want to get back into just being a normal person, or do you want to be that kind of athlete? That's the determining factor of how to approach the therapy. So it's always nice to have it doesn't matter if it's an athlete, elite, or a civilian or whoever, to have the same common goal that you think you should have. It makes things easier. Once they understand about the problem and they understand what their outcome should be and how to process that, then it's a team effort. Now I'm working with him. Now we're both working together. And that's so much better than someone like, I don't know. It feels okay. I'm indifferent. I don't know what's so it's difficult to work with that kind of patients.
Yeah, I'm
You
sure.
you come
Yeah.
across those with athletes too, but more likely, what I like to do is just get them a best knowledge based information about their condition, and then they will understand why I have to do those things.
Do you have to qualify for stem cell therapy?
Well, when it comes to arthritic situations, so it's growing things, right? It's regenerating tissue. But if you're bone on bone and you do an X-ray and you see the knee and the knee starting to change its cortex, it's like it's getting destroyed because now you're a bone on bone. There's no protecting cartilage there. You start changing the actual form of the bone. you're not going to regenerate anything. There's nothing there to regenerate. So qualifying, you have to have the tissue to regenerate. So when you hear someone that I'm bone on bone, I got the X-ray, it looks horrible, but I'm doing stem cell therapy. You're not a candidate. I wouldn't even waste your money. You have to understand your limitations. So that's one thing. If you have a complete rupture, let's say you completely tore your Achilles tendon and you can't do any what they call the plantar flexion, right? Because there's no attachment for the calf muscle to the bottom of your foot. Well, regen or stem cell therapy is not going to do anything because when you tear something, it it separates. So to approximate it, you got to get there and manually pull it together and then hold it there and then not walk. I mean, who's not going to walk around here? So
Right.
those are surgical candidates. So when I you see those things, I'm like, no, you're not a candidate. Now afterwards, when they go through surgery, yeah, now you can do the regenerative medicine, stem cell therapy, because now you're speeding up the process of healing from that surgical procedure.
Does age come into play? Like, I don't know, someone's 80 years old. I mean, is it worth the stem cell therapy?
Yeah, yeah,
It is.
good question. Yeah, think about it. So it's about the signaling. So we have our signals in our body. So it started off in puberty, and then we move ourselves into the active senior life, right? So during that
Tell me
process,
about it.
yeah, so we lose that ability to signal. So it gets dimmer, not enough like bright information, and that's why we heal slower. I remember the days when it was when we were young and I was in the military and you can sit for a long period of time and a whistle blows, you can get out and do a full sprint. Now at my age, I'm 58. I have to think about it. Wait a minute, I gotta warm my knees up. I gotta warm my ankles up. If there's an emergency, I'm gonna have a hard time rolling around here. So it's that signaling. But if you can get the information stronger and brighter as if we were younger, absolutely, you have tougher tissue because it responded and rebounded and regenerated better.
Hmm. Is it a different? I mean, if you're working for a team, I guess it's different. But just in general, is it more expensive to get this type of therapy compared to regular therapy?
So if you're comparing like stem cell therapy versus like just normal, like traditional, like therapy, like like e-stem, ultrasound, some stretches, yeah, it's a big difference. Because number one, you look at what this is. Stem cell is almost like experimental, kind of out of the realm of insurance qualification for it being covered by private
That
insurance.
was my next question, right?
Yeah, so it's not covered. Now, it's almost like it has to be understood that what it does. If everybody understands what the mechanism is, and the biggest thing is that people think that these stem cells somehow mutate. Well, let's start right where it comes from. So, stem cell is they used to draw it out of your own like fat tissue in your bone marrow, put it in a centrifuge and pull out these little stem cells called mesenchymal stem cells and re-inject it into your damaged tissue, and then it does this process. They call it differentiate. It will differentiate into that particular target tissue. So then the problem with that is the signal is the same level as as the fat tissue or the bone marrow tissue. It's the same information. So and the level of information or the signal is the same. So you're not going to get that bright, like shining head beam like that you want from the next tissue, which is from the umbilical cord. They have the same mesenchymal stem cell, but it's a younger and it's brighter, stronger, and it has really good that information that we want. So you take that tissue and then you put it into your tissue. So they think that that tissue is going to mutate into your tissue. Well, if you remember back in the biology days in chromosome and genes, those codes, the ATCG, are going to turn into something like a hair follicle, a liver, something, right? Some kind of stuff. Well, you don't know what you're getting, and how is it going to know your exact code, the existing tissue code, compared to the donor side? Impossible. So you take the next level down, which is a signal. It secretes this information in the form of protein, cytokines, anything you can think of, peptides. All these things are information that our body is craving for. So our cells are sitting, and we're kind of getting older, and we don't get that signal, but it's there waiting in an adult stem cell way. It's just sitting there waiting. So then when you get a bright signal, it turns on, it does its job. And that's what we're craving for, that bright signal. And that signal comes from that donor site. So these signals are smaller. They have no nucleus. That's what they call cell free. And the most important thing about that is that there's no tumor formation. Whereas if you put a DNA or these live cells in your body, You don't know what it's going to translate into from an RNA, DNA replication. It may turn into something that let's say you have a tendon issue, it may grow something like a liver cell or something else that's not supposed to be there. So
Could
you
be a
got to look at
problem.
those factors.
Yeah. Oh, wow. Have you ever had it done
Oh, of
yourself?
course.
You have?
Yeah. I mean,
Really?
in my clinic, I've done it. So stem cell injections, I've seen this all the way from back in 2008, 2007. It was prototherapy, and that they used to inject sugar water in you. And so when they used to get this sugar water in you, your body thinks there's something going on. Let's make it into a antigen, and we'll create an antibody or scar tissue material, and that speed up the healing. So that was one of the theories back then. Then it evolved this thing called PRP. PRP is where you take your own blood, they put it in a centrifuge, get the growth factors out of it, and re-inject the damaged tissue. And then in that information is telling you, hey, grow the tissue. So then it moved into the stem cell that comes out of your own fat tissue or your bone marrow. And then now it's coming from the donor side of the umbilical cord or the placenta to get the same mesenchymal stem cells, but it's a stronger and more bright tissue. The best thing about that is that now you look at it works. There is a mechanism, and it's not so much the DNA component or the live cells. It's really about the signals. You want to enhance the signals by grabbing it, taking it, and now all you need to do is figure out how to get it transformed into your tissue without the injection. Well, topical is the application. So once you understand topical and how to disturb that layer of skin and you transport that down, now you're in the world of regenerative medicine without the injection, without that kind of like that tumor formation because of live cells, and the cost goes down so much more.
Are there any, I don't know if side effects is the right word, or drawbacks that you have to tell a patient, hey, look, we're going to do this. There's a small chance, because you have to really, tell people a lot of information nowadays that, we're going to do this stem cell therapy, but there's a small chance that something might have, or any drawbacks, I guess, or side effects.
There's always a drawback when you're putting things into your body. So I think the biggest thing that, like, prior to me developing a topical world, some of the what they call the contraindicators, you don't want to, inject people that are pregnant, people that may have cancer or open wounds right now. That's still in the research world, but we avoid those type of patients. Then, as far as the normal patients that do the injections, there's always a risk factor with anything surgery, other injections. You think about back in the day with injections, you have to disclose that you may have a possibility of an infection because there's a lot of factors in there. So
Right, right. So
there
you
could be
have to,
that factor. There could be other factors of your body might not respond well to this. It may like reject it, or it could be in the sense of um, you're making a secondary injury site. When you make a secondary injury site with the needle, your body might get compromised. Maybe the provider nicks a nerve, maybe nicks an artery. It may become that kind of scenario. So there's those kind of risk factors. That's why topical is such an easier and safer route. It avoids that type of compromise.
now, does a patient have to come in to have it performed? Can they do it at home and rub it on themselves, or?
Yep, yeah, exactly. It's a home use. It's a home use. So Regen is a kit that consists of two bottles. There's an alpha and omega. There's a morning and evening. So the morning and evening, those two will yield as much as the injectables. The neat thing about that is that it's a 30-day process. You have to take that in a row, 30 days in a row. And then that
Okay.
will yield as much as the injectables.
Yeah. So they're at home and they don't come back in for 30 days. I mean, they follow the procedure. So it's a lot of information. The book can be, I mean, I'm always hesitant to ask this question because the obvious answer is, well, you can Google it, but where can they get the book?
It's on Amazon. Amazon, just the Future of Regenerative Medicine. And then just use my last name, RHEE, and it should pop up.
All right, cool. Great. So before I let you go, what's your what's your team you root for? Was it Tampa Bay, or what's your professional team, whether it's football or whatever? Who's your team?
I think when it comes to professional sports, Tampa Bay. I'm a Tampa Bay guy. I raised here. So all the teams, if it's
Lightning?
the Lightning, the Rays, and of course the Buccaneers. Those are my teams. And then as far as like in general, what's the best team? I love sports. I love to root for the underdog. So when you see a game that's there's a great story behind, like for instance, like NC, look at the national championship for NCAA's, right? I mean, you follow that story. That's a great story. That's what I love. Like a Rudy, it's a movie that's playing in real life.
It's
Love it.
unbelievable. I
Yeah.
know. Oh man. And the Lightning are hot now. No pun intended, but I mean, I follow hockey's my favorite sport. I mean, I watch all sports, but I'm originally from Pittsburgh, so I follow the Penguins. But yeah, I mean, they're on fire. They're having a great season. Now you got the Olympics. So you're into the Olympics? You watch the Olympics? I mean,
Yeah, nowadays I try to stay away from sports and watching sports because then I start getting that anxiety of like I'm on the field and I'm cheering on. So I do watch it. I do watch, especially when it comes to events that um, I'm dear to. Like I love the track and field stuff. I love hockey. It's got a great story behind that. So it's enjoyable. Anything with competition and you have a story behind it, it's a no brainer. You have to watch that. It's just the life unfolds right in front of you.
I agree. I agree. Ever work on an Olympic athlete? Just curious.
But yeah, I mean,
Oh,
many of them. So
okay.
I mean, track and field. I've got some interesting like track and field were like a lot of like the 100, 200 meter people. And then interesting. There's an Olympian that did canoeing. If you ever, it's an interesting sport with that. So I had one of those. Tennis, um, you know, basketball, soccer, women's soccer. So yeah, I've done Olympians.
What's the I mean, the most well, I don't want to say popular. What seems to be the most injury you see? I mean, like ankle, knees, or is it?
When it comes to like injury that prevents you to do any activity, it's always something in the lower extreme, like a knee, ankle. But when you look at the low back, I say that's the biggest complaint with all athletes in all sports, the back, the low back, lumbar. I mean, you're able to do things. It's just that you're going to be doing it during pain. It doesn't stop you. It's almost like you got a deep bruise and you're going to just work through it. Whereas when you have something with the ankle, there's only like really four ligaments that hold it. The knee, I'm sorry, the knee. You only have four ligaments of the knee, and you just take one of those and rupture those or tear those. It's going to give a lot of dysfunction to that joint.
Well, look, this has been great. A lot of information. I recommend the book. I think it'll be valuable to people who want to know about this procedure. But I really appreciate you coming on, taking the time.
Hey man, I really appreciate this. This is fun.
You're listening to Unmuted with Papamutes,